I appreciate everybody coming on time today. Really helps since we have such a busy class. So welcome to week 3. Today for this class, since we didn't have class last Monday, we'll start off by taking quiz 1. We'll take 15 minutes to do quiz 1, and then we'll back to back, we'll do quiz 2, take 15 minutes to do quiz 2. And like I said, then we'll review both of the quizzes, then we'll cover our week 3 content. And then we'll finish up by doing the case study that I sent in the announcements. Does anybody have any questions? All right, so we're still waiting for
covering with quiz 2.
Pardon me?
Exactly what are we covering on quiz 2?
That would be this week's content, week 3 content. I sent everybody out an email earlier in the week that was pretty specific about giving you all the weekly notes, right? The nine sets of weekly notes, and below that I listed out the quizzes, what week it was in, and what weeks of content they were covering. Everybody saw that?
Yeah. I have a question though, if you don't mind, real quick.
Go ahead.
So I read one of your announcements or emails or something that said that we do the quizzes at the beginning of the class so that we can see what we're struggling with. I haven't had a teacher, and everybody's different, that give you the quizzes before you. I mean, I know you're giving us and we're exposed to the information, correct? But like before they actually teach us the information.
Well, the purpose of the quizzes, as I have reviewed, purpose of the quizzes is for class preparation.
Bless you, son. Right.
Okay, so you should be getting the content in your readings and in your weekly notes.
Yeah, we are.
But hold on, so we taking a quiz on week 3 that we only have notes on, but we haven't did up.
You have notes on. You have your weekly notes on, and you have your weekly readings to do.
Right. Yeah, and that's fine. But what I'm asking is like, why do you? And I got again, your email said that you're doing it to see what we're struggling with, but I mean, if they're graded, they're going to our key graded assignments. To me, it just doesn't make sense. Yeah. Although I have my reading stuff, what if I don't interpret it the correct way? And then you're quizzing me on it, and I'm failing it, and then you're still seeing what I'm at, but that's bringing my score down if I'm not understanding something. You know what I mean? Like you're quizzing me before I can fully understand something. You want this one?
Okay, so the quizzes are designed to be given at the beginning of the class to look at everybody's preparation. I understand what you're saying. But the quizzes are designed throughout the whole program to be given at the beginning of class.
For you? For your program or the everybody program? You're the only teacher that had to do that.
Everybody's program. Quizzes are given at the beginning of the class.
Okay.
And if there are classes that they're not given at the beginning of the class, please let me know.
If they given at beginning of the class, it's usually what we learned the week prior, not what we supposed to be learning in the future.
The quizzes are designed to evaluate your preparation for this week's content. And this
so it should be a practice quiz rather than a key grade assignment. But you go ahead. I mean, I read. You know what I mean? It is what it is. Okay. I just wanted to ask.
Okay. Does anybody else have any questions? Okay. So go ahead. We'll go. I think we'll just go straight through. So you take quiz 1 and then just follow that up with taking quiz 2. So it'll be 30 minutes, 15 for each. Okay, and please hit submit when you've completed each of the quizzes. Okay, so it's 3:05 now, so we'll go to 3:35. All right, so go ahead and take them. They're open. Both of them are open for you. So just take them back to back, and then we'll review them together. Okay? Take your time. You have 15 minutes for each of them. Take your time. Hey, we're still waiting on a couple more students to finish quiz 2. I sent the 3 students a message in the chat if you could let me know when you're done so we can review it. Here we have one student we're waiting on, and then we'll review them. Okay, I think we're all set. Okay, great. So if everybody could get back on camera. Thank you. Okay, let's take a look at quiz 1. Okay. Okay, can everybody see my screen?
Yes.
Okay. So, what is the difference between community-oriented and community-based nursing?
Community-based is tending to illness inside of a community, like the hospice nurse, school nurse, and the community-oriented is like prevention to like everyone, kinda.
Okay. Okay.
Thank
Yep, great. So what would be the correct answer to question 1?
Illness care of individuals in the community. No, it would be
No.
evaluate. No, I'll read out loud. Evaluating the outcome of the
Yep.
community vaccination
Yep.
program.
Because it's a community program focused on the whole community, correct? All the other 3 answers are considered community-based. And like Charmaine said, the way I remember it is community-oriented is the big picture. You're looking at the big population. Community-based is you're working in the community. All right. So school nurse, hospice nurse, home health nurse, working in a clinic, occupational nurse. Okay? You're based in the community. Number 2, which describes the purpose of Healthy People 2030. This is from your week 1 assignments to get on that website. Plus, it's also in your week 1 notes. So what was the correct answer? Or how about what is not the correct answer? There's one there's one that's not correct. Which one is that?
Is it the create standardized nursing curriculum?
Right. It has nothing to do with creating a standard curriculum for nursing.
Don't do that.
Right? It's everything else, plus then some. In your week 1 notes, I think there's like 6 bullets of what are the objectives of Healthy People 2030. A, B, and D are 3 of those 6. Okay. Question 3. What's an example? If you reviewed the weeks 1 and 2 content recording I sent you from last Tuesday's class, then I had reviewed primary, secondary, and tertiary. Can somebody, before we even answer number 3, what's primary, secondary, and tertiary? What's primary?
Primary is like you're teaching them about, what they need to do to prevent something. And then secondary is the screening, like you get, like us women, we got to get pap smears.
Yep.
And then tertiary is like when you already have something, like if
Right.
somebody already have like diabetes, you're going to,
Yep.
get on their medication or whatever.
That's exactly right. So I remember it as primary is P, which is prevention. Secondary is S, which is screening.
Screen.
And tertiary is T for treatment. Awesome, Crystal. Awesome. So which is it in question 3? Which is an example of primary prevention?
Is it A?
Prevention of a problem before it even occurs.
Absolutely. What is B? A is the correct
Screening.
answer.
Secondary.
Okay. B is
Secondary.
screening. What about C?
Tertiary. I can't say the word, but the T word.
Yeah,
Tertiary.
you had it right.
Tertiary. Thank you.
Management of a disease. You already have it. And then what is D?
Screening.
Screening. Yep.
Screening. I also like to refer to secondary. I know it's screening.
Oh, so
But-
secondary.
You're trying to screen for risk. That's why you're having a mammogram, right? That's why you're having a prostate exam. That's why you're having annual blood sugar testing or annual blood pressure testing. Early intervention, early identification, early screening. That's what secondary is all about. You want to try and prevent something from moving into tertiary, right? You're trying to stop it in its tracks. Question 4. Which client is not considered? Hopefully everybody saw the word not considered.
Yeah.
The
I had to read it.
tuberculosis,
Yeah.
23-year-old.
Yep. Yep. And what if A had said 26-year-old? Would
But
that have been
wouldn't have mattered.
considered?
That would have been right,
That's
'cause
not a
the-
teen pregnancy.
Right. Right. So that's a teen pregnancy, which is considered vulnerable, right? And we know veterans are vulnerable, substance abusers are vulnerable. Yes, tuberculosis is not good, but it's not, it's a
Vulnerable.
condition in itself. It's not a whole population. Which of the following are considered nursing interventions in caring for the vulnerable populations? Select all that apply.
It's all of them. Every single one.
Yeah, I'd say all of them. All.
Every single one. Right? And that came from your week 1 weekly notes. Okay, you want to increase resources, try and reduce health risks, obviously assess the amount of stress. That's going to have a big impact on how they deal with things, and then reduce health disparities. So all apply. Okay, what does the term resiliency mean? What does that mean?
It's like the ability to weather the storm. Like if something is wrong, you're able and you're equipped to get over that. You're resilient.
Yeah. And so obviously one of the things that we try and work on with vulnerable populations is resiliency, right?
Really. So it's
Right?
vulnerable to a
Yes.
certain risk.
Right? The more, so what statement reflects resiliency? Okay, it reduces our vulnerability. The rest of them are the opposite.
Mhm.
Okay? The lack of resiliency increases the chances that you'll get sick. It's
Mhm.
certainly not dependent on only on genetic predisposition. And yes, it can be learned. Absolutely can be learned. That's part of our job in the community. Well, part of our job as nurses overall is to try and increase resiliency in anybody we're taking care of, regardless of what age group, right?
Yes.
Question 7, which is not considered one of the 5 functions of a family.
Education.
Education. This was in your week 2 notes, the 5 functions of a family. And we'll go through, we already actually went through that. I went through that in the recording. Okay. You have financial, reproductive, socialization, affective,
Affective. That's all we know.
affective, and it's in your, let's see.
Socialization.
That's already in there though. That's D. It was
Financial health.
Effectiveness.
Reproductive.
effective. Hang on, let me pull up my notes. I'm pulling up the notes I gave you. Week 1, it's in your week 2.
It's on page 4. It's
Yep.
effective.
Effective, financial, health. Health is the other one. Health and affective.
Oh, health, yeah.
Okay. Health and affective are the other 2. Question 8. The school nurse is practicing tertiary prevention in the school clinic. So what's she going to be doing?
Administration, medication.
Medication, because that student is getting medication for some reason, right? Whether it's from an injury, from a bike fall, whatever. It's from a condition, a disease, a diagnosis. Okay. What is B? Primary, secondary, or tertiary?
That's
Primary.
primary.
Primary. What about C?
Secondary.
That is secondary.
Screening. And what about D?
Secondary.
Secondary.
Screening. Okay, which would not be considered an appropriate intervention for a student with ADHD?
D.
The last one, D.
The last one, right? Yes, some students may need to work with a one-to-one, but this assumes that everybody does. And that's not the case. Right?
Yeah.
Okay.
Right.
Number 10, which statement is true in regards to acute conjunctivitis? Select all that apply.
Is it the first one? And then I know it's the last one. And then
And the second one.
Okay.
no.
No,
Which one is wrong?
Eye drops. It's the
There's
fourth
3
one,
right
third one.
answers.
Oh, I was telling you which one is. I'm sorry.
Oh, you were
wrong.
saying which one was wrong?
Yeah, that's my
No,
fault.
I asked which one was right at the beginning, but there's 3 that are right, 1 that's wrong. So let's
Yeah.
go to which one is
Sorry.
wrong.
The one that's
B.
wrong is
B.
B.
Correct. Correct.
Ah.
It is typically treated with antibiotic drops,
Mhm.
right? And
Right.
everything else about that is correct. All the other 3 answers are correct. Anybody have any questions about quiz 1? Looks like overall you guys did good. All right, let's jump to quiz 2, which is today.
I'm in class, so you
Okay.
do something.
Which should the home health nurse anticipate about clients that live in a rural community? Select all that apply. So there's 2 correct answers. What are they?
A and D.
Correct. Let's go through this.
Upstairs.
Okay. Certainly, as you read in preparation for class, between migrant farm workers, rural community, that population is much more likely to have chemical exposures, correct?
Yes.
And go into D, the second correct answer. They are much more likely to have complex chronic illnesses, right?
Mhm.
However, let's look at B and C. They don't
Well, they
have
don't have physicians and they don't have employers that's going to give them Insurance, 'cause they
Exactly.
under the table kind of.
Exactly. So these are considered barriers, right? So B and C are considered barriers, right? They don't have adequate access to physicians. They may have one family physician in the whole community, or that covers 2 or 3 communities. They don't have specialized care, right? They don't have pediatricians and OBs. And, you know, if you're having issues, you have to go outside that rural community to seek help. And then most of them will actually not have employee provide insurance. Why is that? What kind of jobs does this population typically have?
They got jobs that's outside. What is it like?
Hourly?
Agricultural,
Not
forest.
hourly.
Yeah, they typically have,
Agricultural jobs.
right. They typically have hourly jobs without insurance, right? So if they have to travel down to the nearest city for care, they're less likely to do that because they'll miss a whole day's pay,
All day work. Mm-hmm.
right?
Especially if someone getting paid by the day.
Exactly.
Like if you get paid by the day, then you miss
Yep.
that one day, you don't get no money.
So most of them do not have employer provided insurance. And think about it. Health, dental, vision, all that's an issue, not just medical. So one of the things we see in the rural and migrant population is a huge increase in dental issues. Huge. Okay, the nurse is developing a tertiary prevention program for members of a rural community. Which intervention is appropriate?
Provide information.
No, it's educate
A.
families. Like Kiki said, it's on diabetes. They already have it, so you're educating them.
Exactly.
Oh, tertiary. Yeah, they already have
They
it.
already have it,
Yes.
right?
Yep.
What about B? What's B?
That's hereditary.
That's provide information on minimizing your prevention. It'd be primary.
Prevention,
That's the one.
right? Because
It's all good, girl.
we know that typically this community is at much higher risk for pesticide exposure
Mhm.
because of what they do. All right, so that's primary. So we're trying to minimize, provide information on how to minimize exposure. What about C? What's C?
Screening.
Which is secondary, right? And then what about D?
Secondary.
Screening. Is everybody understanding these primary, secondary, tertiary questions? Because you're going to get several of them on each exam. So we got to make sure we understand these. Okay, and if you don't, speak up so we can review it. Okay, so a migrant farm worker presents to the migrant outreach clinic and they're complaining of abdominal pain, nausea, vomiting, diarrhea, skin rashes, eye irritation, throat irritation, and difficulty concentrating. What do we think this could be?
Poisoning. C.
What?
C.
C.
Poisoning symptoms.
Yep. In your week 3 notes, on page 2, I have highlighted a section that is pesticide exposure. Okay, this, all these symptoms are classic for a potential chemical pesticide exposure. Okay. Of course, we're not going to be requesting a physician's order for an antihistamine because we're not even sure what it is yet.
Right.
Right? We're not complete a TB screening. This is not what those symptoms are presenting with. Right? Evaluate other members for signs of conjunctivitis. This is way more than conjunctivitis. Right? So these are classic complaints of a potential pesticide exposure. So the correct answer is asking them if they're exposed. Right? During a home visit, the nurse notes the migrant farm worker is living in a small house with several other families. Which nursing assessment is a priority?
Tuberculosis.
Right. So
It's too many of them.
we know that migrant families typically are living in close quarters with multiple people. And from your readings, you know that one of the risks of that is an exposure to TB. Right? And so the question is also has an important word in there. It's priority. Right? So it's not that some of the other answers could not be correct. It's asking what the priority is. Well, what we know about migrants and housing is that we should be screening for tuberculosis, right? And this is also a good example of, and this is just a test taking strategy. Okay. If you come across a question and there are more than one answer that looks like it could be correct, but it's not a select all that apply, you have to go back and look at that question to see if there was something in that question you missed, like priority, or what's the first, or what's the initial. Okay, because you will come upon questions that are not select all applies that multiple answers look like they could be correct. Typically means you've missed something in the question. A word, a phrase, a cue. Does that make sense?
Mm-hmm.
Okay. That's one of my big test taking strategy tips. Okay, which statements, okay, reflect the impact of income on health outcomes? Select all that applies. So this is a poverty question. Okay.
So,
A.
B, and D.
yep.
A, B, and D.
Yeah.
We know that low income increases the risk of chronic illness. We definitely know that low income could reduce the attendance at wellness visits. Okay. And we know that low income does not improve health outcomes. Okay. Question 6. Which should the nurse anticipate for a family living below the federally defined poverty line? Select all that apply. Okay, we know that A is correct. It's A, C, and D. Poor health families living below the federally defined poverty line are at risk for poorer health outcomes compared to those living above.
Insurance.
They have increased vulnerability due to lack of insurance. Right? And they have increased vulnerability due to fewer community resources. Right? And B is incorrect because there is a difference.
Mm-hmm.
It's not unchanged. It is changed, actually, whether you're below or above. It does change the way we have to look at things and potential outcomes, right? Which client is at the highest risk for adverse health outcomes related to poverty? So before you answer this, okay, there's a couple of things in here. Highest risk. The highest.
Because that's like being vulnerable. So the 15-month-old.
Yep.
Okay.
Doesn't have a
They don't have no medical history. So how we gonna know?
Exactly. Exactly. It's not that a 19-year-old with asthma is not adverse to health outcomes, or a 44-year-old working on a farm is not at risk for adverse health outcomes, or the 68-year-old with type 2 diabetes. They're all at risk for adverse health outcomes. But what the question is asking, who is at the highest risk? So that's another question that you get to it and you think, well, all of those guys look like they could be at risk for adverse health outcomes. But then you have to
at first I was gonna pick the diabetes, but then I took my time and went back and read it. The 15-month-old, like that's the most of it. Like how am I supposed to know what shots they had?
Why is it 15 months?
Because they have no medical history.
They don't have no medical history.
So we don't know about vaccines. We don't know about any kind of medical history. So they become the highest risk because we have no
Okay.
history.
I remember on HESI, on the HESI, it was a question, it was something like this, but not really. I was kind of confused about the situation, but I had figured it out.
Did you figure it out?
Yes, but it was after I picked my answer.
Okay, let me pose another question to you. It's not on here, but I'm going to pose it to you. Which client no, we'll get to that. It's about the age.
Okay.
I want you to know that if you get a question on a quiz exam about who is at the highest risk for adverse health outcomes, and you're given age groups, who from your reading, who is the most vulnerable?
Elders and infants.
Kids.
Kids, okay.
Kids are the most vulnerable. So if you have to pick between a 12-year-old and an 80-year-old,
The child.
they are both extremely vulnerable. Got it. But if you're asked who is most at risk,
the children are.
the children are. Remember that. Okay. All right. Which would the school nurse expect for an impoverished adolescent? So now we're talking growth and development. Okay. We're talking specifically an adolescent. That's it. The question is addressing about an adolescent. What is the biggest risk?
C.
Correct. Here's another question. Okay. They are at increased risk for dropping out of school.
Right.
They are decreased attendance. Remember, they're impoverished adolescents. Certainly the correct answer, increase risk of unintended pregnancy. And they don't have excellent use of adaptive coping mechanism. In fact, that's probably very challenged for them. Okay?
Mm-hmm.
Everybody get that?
Yeah.
Okay. Which client is at highest risk? Another question where more than one answer could be correct, but it's asking what's the highest risk?
A veteran.
Yeah, veteran.
With PTSD.
Right? Living alone.
Living alone.
Who's watching over? Who can help? Who can help if they need help?
Going to a crisis. Yeah.
Right. Yes, the older child has a history of suicidal ideations, but they're in therapy.
Right.
The adult with schizophrenia is living in a group setting.
Group home, so they got somebody to watch them.
Correct. Adolescent with substance addiction with
They
a
got
supportive
support.
family. Okay. But that veteran with PTSD and living alone,
No support.
No support.
Therapy.
Right?
Mm-hmm.
Last question. The nurse is working with the homeless population. What might she observe, or he?
All of them.
Mm-hmm.
Everything. Right? All four of these answers go along with what you might observe in working with the homeless population and more. Okay? So, having gone through those, we'll do some content from this week. How do you feel about the 2 quizzes? I like to teach content from the quizzes. That's why we spent a half an hour on them. Okay. There's more to know, but there's a lot of teaching that you can do going through these quizzes. Why is the answer correct? Why are the ones incorrect? Incorrect. So how do you feel about that?
I mean, honestly, I am used to my teachers like teaching me first, but I did really good on both of them.
Okay.
I printed out the stuff that you gave me, and I read that, and I took notes on that, and I did pretty good. I can't lie, I did.
I was thinking about something, about what our discussion was at the beginning of class, where you're typically used to going through the content. You guys actually had week 1 and 2 content before this quiz because you had the recording from last week, right? So I mean, the great spot check and the grades for quiz 1 from last week were really good for all of you. So good. So I'm assuming you watched the recording. I'm assuming you read your weeks 1 and 2 notes. And I'm assuming you did your weeks 1 and 2 reading. And by the scores I see on the quiz from today, it looks like you guys did your week 3 readings and read your weekly notes. The grades were really good. And that's what the quizzes are, is just, it's not, they're not gotchas. They're just making sure that you guys are doing your own due diligence and doing your own preparation, right? They're not meant to get you, right? They really aren't. So don't look at them that way. Let's go through the content for week 3 and let's see what we haven't gone through yet. Oops, didn't share my screen. And really, the other thing I appreciate from all of you guys going through those 2 quizzes is I really appreciate all your participation. That's good. That's really good. Really good to be engaged. And it tells me the more everybody's participating, the more they're comfortable answering the questions, right? Because they know it. They know the content. So that's awesome. Awesome. All right, let's go through this, see what we have to cover with content. All right. So because you just took the quiz, you know what the concepts were covered. Migrants, rural, homelessness, and poverty. Okay. We know with migrants, right, they typically work seasonal. Oh, by the way, your readings for this week, above and beyond the weekly notes I gave you, all your 4 readings were embedded into your module, right? Those were excellent, excellent readings. And if you did those along with looking at the weekly notes, that's why you did well on the quizzes. Okay, so these notes are, when I put together these notes, a lot of these notes are from your readings from your module. All right, so we know that migrants are seasonal. We know they move around a lot. We know they don't have a lot of services available. We know there are language barriers, right? We know there's transportation issues. We know there's housing issues, right? We know that typically female migrant workers are at higher risk of sexual harassment and abuse. We know that kids are really at risk, kids of migrant families. Everybody's at risk in a migrant family, but kids are really at risk. Sun exposure, pesticide exposure. And think about kids working on the farms. They may have less access to schools, right? Less access to immunizations. Okay. And we know that our food supply here in this country would collapse without the work of our migrant farm workers, right? They're kind of our unseen population. Okay. We talked about their lack of housing or substandard housing. Okay. When housing does become available, overcrowded, which you got the question right, can contribute to things like TB, GI issues, hepatitis issues. We know from our common childhood ailments concept that older housing for migrants, or anybody for that matter, potentially exposes to lead. Right? We know that migrants have a much, much higher risk of complex chronic diseases. Diabetes, hypertension, poor dental history, obesity, depression, substance abuse, alcohol abuse. And then the kids, we already talked about, but the additional risks for them: malnutrition, infectious diseases, ear infections, dental issues, immunization status we talked about, very exposed to pesticide issues, right? Disruption of schools we talked about, and just really if they're traveling with their families, they're always moving around. There's no consistency, right? Very unlikely that medical things, medical issues, or medical services that they seek will carry on to the next place they go, right? So let's say they're diagnosed with hypertension or, I don't know, diabetes in one area they're working in, and then they move 3 months later. Highly unlikely their medical records are going to get transferred with them, right? They're starting over. I would like for you to review here. I need you to understand, if you're given a question with particular symptoms, you need to understand the difference between acute pesticide exposure and chronic. We talked about acute because it was one of our quiz questions, but chronic. Let's say somebody's working in the farms for 5 years, 7 years, whatever, 3 years. That's chronic. All right, they're chronically exposed, right? So chronic exposure to pesticides, birth defects, cancer, blood disorders, maybe neuro problems, reproductive issues, and so on. Okay, so be able to recognize in a question whether it's acute or chronic. Okay, there's a lot of similarities between the migrant population and the rural population, because the migrant population is typically working in a rural community, right? When we could talk about rural, we talk about farms, small villages, small towns, much less populated. Okay, typically some information about rural is it's typically younger than 18 and older than 65. They typically have lower levels of formal education. Okay, nearly 25% of rural Americans live near or below the poverty line. And that equates into almost 40% of rural children living in poverty. Okay. We know, we've already talked about, fewer residents in the rural community have insurance or adequate insurance. And they work in much higher risk populations. Therefore, they're much higher at risk for getting ill. Whether it's a chronic disease, whether it's a injury from a piece of equipment or a tool they're using, much higher risk for injuries. We know that rural adults do not prioritize their preventative healthcare, right? Who can take a day off to go down and see your primary care? Right? They're much less likely to prioritize their preventative activities. So therefore, much higher rates of smoking, much higher rates of alcohol abuse, like migrants, obesity. They're much less likely to engage in any screenings, really primary and secondary prevention. A lot of times, by the time you see this population, they're already at a tertiary level. Right? So we know they're less likely to seek medical care. They're less likely to have health insurance. They are more than likely to have chronic diseases, more than likely to have mental health issues, substance abuse issues. Right? Some of the barriers, transportation, health illiteracy. You know, maybe they don't understand, maybe non-English speaking. So when they do go to a doctor, they're afraid to go to a doctor because they can't communicate what's going on. Right? And if they can't communicate what's going on, why bother going? Because you don't understand what they're telling you anyway. Okay. Rural areas have 4 primary high-risk industries: forestry, mining, marine-related fields, and agriculture. We talked about these particular industries higher rates of accidents, machinery accidents, car accidents, trauma, cancer, chronic illnesses, asthma, respiratory conditions, right? So it's a big difference with a migrant/rural population as is in the metropolitan areas. So much more risk for this population. Think about being a community nurse in that population. Think about being, one of my teammates is a community nurse in a very, I think she's on a tribal, works in a tribal area. She's the only nurse, right? She may be the school nurse. She may be the clinic nurse. She may be the nurse that's one that has the resources in the community. Think about being a community nurse in a rural populated area versus a large metropolitan area, right? Okay, any questions on rural and migrants? Okay, our quiz covered quite a bit of it. All right, homelessness and poverty. Okay, let's see. I don't need to go through statistics. We know that the federal poverty line is set by the government annually, right? We know that there's a lot more resources for people living below the poverty line versus at it or above, right? What does poverty mean? Insufficient resources to meet the family's basic needs. What are those basic needs? 4 basic needs that are considered or factored in when identifying where a family falls on the poverty line. Food, shelter, transportation. What?
I often say financial.
Food, basic needs, food, shelter, transportation, and healthcare. I mean, think of ourselves and our families. Do we know people that just they have insufficient resources to meet all these needs? What are some contributing factors to poverty? Unemployment. Maybe loss of retirement benefits if you lose your job or you get laid off. Okay. What else? What else contributes to poverty?
I feel like generations contribute to poverty. I don't know if that's our topic or not.
Generational poverty, sure.
If you pass that down, like if you don't want better for your kids or your grandkids, they just copy and do the same thing that they see.
Yep. We call it generational poverty.
Really
and then think of what living in poverty leads to. It affects everything.
Yeah.
Okay. Affects your health, affects your mental health, high rates of chronic illness, higher infant morbidity and mortality, maybe a shorter life expectancy, much more complex health problems, maybe an increase in disability related to chronic illnesses, higher rates of hospitalization. Think about kids who live in poverty. Maybe they don't have access to adequate health care. They don't have access to adequate schools. They don't have access to adequate nutrition. Right? If you're living in a community that has a high crime rate, right? But you can't get out. Okay, maybe that you're living in a community that has a high unemployment rate, which leads to higher poverty. Okay, kids that live in poverty. We talked about lack of adequate nutrition. Maybe that affects their brain development, exposure to toxins, trauma, abuse, just a lower quality of life, lower schools, lower daycare, right? What we know about teens that are living in poverty have below average academic skills. They're 3 times more likely to drop out of school. Higher rates of, this is one of our quiz questions, higher rates of teen pregnancy. Okay. Teen pregnancy, we'll cover that next week. What does that lead to? Low birth weight babies, premature babies, babies with birth defects. Right? And then we talk about homelessness. What leads to homelessness? So many things lead to homelessness.
Yeah, mental illness. I haven't
Look at
died.
look at our communities. Every one of us live in a community now that is inundated with homeless population, right? Just seems like it's increasing and increasing. You know, who knows why they're homeless? Most people don't want to be homeless.
Right.
But if you're working with the homeless population and you're trying to develop that trusting and caring and non-judgmental relationship, they will tell you their story. And you should know their story of how they ended up where they are. Okay? It could be a loss of a job. It could be substance abuse. It could be disability. It could be mental illness. It could be divorce. It could be housing issues. Right? So what are we going to see in the homeless population? What's one of the biggest things we're going to see in the homeless population?
Drug use.
Exactly. Substance abuse and mental illness. Okay. We definitely see more increase in abuse, violence, right? Mental illness, substance abuse, chronic illness, maybe skin issues, maybe heat, cold or hot exposure issues, right? And I remember this from the schools, the homeless definition doesn't just include people living on the streets.
Not having houses.
That's true.
Exactly. I saw this when COVID happened. People lost their jobs. They were moving in with family members. So homeless is not just on the street, but it can be those staying with friends or relatives. It can be those staying in shelters, right? Where they actually have no place to be discharged to, right? So we tend to think of homeless as living on the street. Okay. Homeless people exposed to the elements, crowded, we talked about this, unsanitary living conditions, malnutrition, lack of sleep, chronic stress, leads to, we talked about this. One thing we didn't talk about, obviously, it increases the risk of infectious and communicable diseases, increases the risk of trauma, increases the risk of suicide attempts. And this I found this is an absolutely dreadful statistic. The average life expectancy of a homeless individual is 44. As opposed to 78. One of the things we need to think about in working with the homeless is that we need to respect the individuality of every person. Many factors contributed. We don't know. We don't know their story until we talk to them. Right? We can't be stereotypical. We can't be judgmental because you know what? We're going to probably be wrong. Right? And if we become biased or judgmental, one of the first things we have to try and develop with this population is trust, therapeutic communication. If you come across as being judgmental or insincere or not compassionate, they're not going to open up to you. And these are the people that most need resources, right? And we are their facilitator of resources as the community nurse, right? We can't make any assumptions. We want them to tell their story to us. And especially homeless families with kids. We've got to be able to assess what this family needs. What do these kids need? Do they need immunizations? Do they need teenage pregnancy guidance? Right? These moms and dads are not going to open up to us unless we have developed a trusting and caring relationship with them. Right? You can read this on your own. This goes through primary, secondary, and tertiary for all the 4 topics we covered. Well, let's just go through it. All the 4 topics we covered in week 3. So here's some primary prevention. These are kind of all over the place. Teach ways to avoid pesticide exposure on the farm. Advocate for childhood immunizations, another prevention. Advocate for better living conditions of rural migrant farm workers to prevent crowded living conditions. Right? These are all primary. Secondary, when we're doing our family assessment, screening for evidence of financial instability, especially those with chronic conditions, that's screening for risk, right? Screening yearly blood pressure checks, blood glucose, A1Cs, educating on the importance to schedule your screenings, pap smears, colonoscopies, mammographies, right? It's all about early identification, early intervention. And then tertiary, providing guidance on maybe a non-pharmacological management of lower back pain. So they have lower back pain. So we're educating them on ways to manage that. Helping a homeless client find resources and apply for resources. They're homeless. That's the issue. That's why it's tertiary. Right? Referring to health department for treatment of, say, STD or HIV. They already have something. Teaching a child how to take their medications. That was one of the quiz questions. That's tertiary. They're taking medications for a reason. Okay? So, does that cover those 4 concepts? Hopefully a lot of that was a review from all the readings you've done, right? Whether it be in the modules or your weekly notes. Okay, so now what I want to do is I want to do that case study. So for all of you at your computer, bring up the case study from week 3 announcement. It looks like this. Oh,
I printed it out today. I didn't know what it was. I just printed it out.
Yeah, it's a case study, so let me tell you about it. Hang on. So here's what it looks like. Week 3 case study. Rural migrant health. So this is a case study. There's your case study, and there's 3 questions. Okay, so I've got 3 breakout rooms open. I'm going to just put you in a different breakout room. I don't know where you're all going to end up. And then I'll open it and you have to join. I want your group, if you're in breakout room 1, you're going to answer question 1. Breakout room 2, you're going to answer question 2. Breakout 3, you're going to answer question 3. So I want you to discuss that in a group for about 10 minutes. And then we're going to come back and we're going to answer the 3 questions. This reinforces the teaching and what we've been doing with regards to migrant and rural health. And the reason why I picked a case study for migrant and rural health is there's numerous questions on the exam 1 about migrant and rural health. Okay. So I just want to keep reinforcing that teaching. Okay. So bear with me while I get you all into, take me a second to get you all into a breakout room. So discuss your question, and then we'll come back and talk about the 3 and talk about the rationale. All right. Of your questions of why it's right and why the other answers are wrong. Okay. So I'm just gonna, how many people do I have? 2, 4, 6, 8, 10, 12, 14, 16, 18. So I'm going to put the first 6 of you in group 1. 2, 4, 5. The first 6 are going into room 1. So that is Alaya, Alishka, Charmaine, Chelsea, Courtney, Crystal. And then the next group 2 is Tashas, Chiquita, Jatarius, Geraldine, Janisha, 2, 4, 5, and Jordan. Okay. Mm-hmm. And then 3 is all the names I didn't call: Caprice, Kelly, Kayetta, Latoria, Lizzie, Nina, and Tatiana. Okay. So I'm going to open the room, so you just have to join and then go ahead and start. Got to join. You guys have question 1, okay?
Okay.
Okay.
You guys have question 2, right?
It was a case study.
Yes? Case study is right in your announcement. It's at the bottom of your week 3 announcement.
Isn't the announcements? Oh, yes,
Announcement, week 3 announcement. It's at the bottom.
week 3.
Right under your week 3 weekly notes. It says case
Uh-huh.
study, okay?
Okay, case study, here it is. Okay.
So somebody needs to pull it up.
Oh, yeah.
You guys have question 3, right?
Yeah, we do.
Okay.
Yeah.
Everybody, everybody should be coming back in. We'll just answer these questions real quick.
We
Go through
back.
You back? Awesome.
Well, I say, oh, you ain't ready yet. Never mind. I'm hush.
No, wait. Where is everybody? We're almost done.
Isaiah.
Here comes everybody.
Oh, is we back now?
Yep, you're back in the main room.
Oh, okay. Oh, we ain't get a chance enough time.
Well, I gave you had almost 10 minutes.
That seemed like 2 minutes.
That don't seem like
it took a few minutes for it to start.
8 minutes to find the case.
All we did was read the question.
Okay. All right, so I'm going to share my screen. I'm going to pull up my instructor version. No, that's the case study. Hang on. I mean, okay. So I don't want to show you this quite yet. All right, who had question 1?
We
We
did.
did.
What's the
picked
answer?
C.
We
C.
picked C.
You picked what?
C.
Okay,
Lack of resources with
Lack of
other health
resources.
professionals to interact well.
absolutely.
Because she's
That
in
is
a
the correct
rural
answer.
area. That means they really, really spaced out. They're
And
not
let's look at the
funded.
rationale for that. Some of the challenges of the rural practice are professional. So this is us working in the community, professional isolation. There's just nobody around. There's nobody around to ask, right? Limited opportunities for continuing education, lack of other kinds of health personnel or professionals who you can interact. If you're getting a second opinion, you might have to call down to the cities, right? Heavy workloads. We talked about that. That community nurse in the rural community is doing everything. Ability to function well in several clinic areas, right? So that's that big toolbox. If you're the only nurse in the community, you're doing peds, you're doing Jerry, you're doing med surg, right? You're doing maternity.
Oh, good.
Lack of anonymity. We didn't really talk about that, but that's a big issue in the rural communities. Everybody's afraid to come forward with anything because they're afraid everybody's going to know their business.
Their business.
Right? And so a lot of times, by the time you finally see something at the urgent care or whatever, it's already in a very heightened state. Let's say it's domestic violence or child abuse or substance abuse or mental health crisis. They're not going to jump and do this preventative and secondary care, right? They don't want everybody knowing about it. And a restricted social life, right? Many nurses value the close relationships with clients, and that happens in the rural areas, and coworkers, along with all this diverse clinical experience they're getting. All right, but typically there's long hours, right? There's greater autonomy. Obviously, you're the only one there. And some people like living in the rural areas. So you're right. Lack of resources with other health professionals to interact with was the correct answer. Let's go to number 2. Breakout room 2, what'd you come up with?
D.
D.
D as in dog? Yeah.
D as in dolphin.
Yeah, correct. Okay, so the nurse is considered an authority figure that should respect the individual. All right, you should be able to relate, should have an understanding of the culture, should be able to relate to the individual and try and maintain the best you can the individual's dignity. So here's some information about the Mexican culture. They prefer polite, non-confrontational. Okay, a lot of times you might think they're understanding what you're telling them because they're nodding, but they don't. Okay, so you have to find a way to validate, right? Validate their understanding, right? They like to talk, this Hispanic community, they like to talk about personal matters in the first few minutes. They expect the nurse not to appear rushed and to be a good listener. Humor and touching as a caring gesture is seen as a positive behavior. So the whole point of this question was understanding the Hispanic culture. And why is a question asked about the Hispanic culture? Because the majority of migrants are Hispanic, and there's a lot of the rural population that's Hispanic. Okay, what's the answer to number 3? Room 3.
We got C, D, and E. Do you want the rationale as well?
No. Well, we can read the rationale. So what are your answers?
C, D, and E.
We were
C, D.
debatable with A too. But
Okay. So the correct answers are C, D, and E. Okay. So the
Good job.
here's your rationale. The physical demands of harvesting crops 12 to 14 hours a day will take their toll on your musculoskeletal system.
Mhm.
Back and neck pain were the most common types of chronic pain reported. Right? Also, we talked about exposure to chemicals, pesticides. So naturally occurring plant substances, applied chemicals may cause irritation to the skin. Right? So contact dermatitis, chemical conjunctivitis. Okay. Green tobacco sickness, dermal exposure to wet tobacco is experienced in 50%. Eye problems are often caused with exposure to chemicals, dust, pollen, lack of eye care, and really, for that matter, lack of eye protection available to them.
Mhm.
And then cancer is something else that needs to be considered. Okay, can't long-term working, that's that.
The sunlight.
Yeah, that's that difference between acute exposure and chronic exposure. Chronic exposure to pesticides can very well lead to cancer,
Mhm.
right?
Right.
So did you guys get that right?
Yeah.
I think all you guys got those right. All of yours right. Good. It's just reinforcing the migrant rule. So, okay, we covered a lot today. You guys tired? I'm tired.
Mhm.
Okay.
We got
Did you learn?
exam. We got
Did
an
you learn a
exam
lot?
the day before my birthday.
What?
I said we got an exam the day before my birthday.
So, Professor Ford already had her exam review yesterday morning, Sunday morning. I've already sent you the recording. Okay. I have mine coming up Friday. And then
Is Dr. Kirchhoff's hers is still on Sunday?
Sunday evening. So you
Okay.
still 2 more to go to, and you'll get both recordings.
Okay.
I encourage you to take your study guide with all the concepts listed. I think you have 12 of them. Start filling those out by using what we talked about in class. Even pull out of your quiz questions if you want. So you have your weekly readings, your weekly notes, your lecture, and the quiz questions are actually very good. So between those resources, you have enough to build on each concept in your study guide. And if you're doing that, you're going to ace the exam.
And when our exam?
Next week.
29th.
Oh, you said a day before your birthday, baby. That's on my
A week
birthday.
from today. A week from today, you'll be taking your exam.
Yeah, that'd be a good birthday gift. Pass that.
Yeah.
All right, listen, you guys. I appreciate you staying. Long class. We covered a lot. I hope you learned a lot.
So what time does this class actually end?
It's supposed to end at 4:50. So
Okay.
we're 2 minutes early of that, but we didn't take a break. So I'm actually 6 minutes late.
We good. Goodbye. Have a great
right. Thank you.
Bye, y'all.
Thank you.
night. See y'all next week.
All right.